Hello everyone, especially those wonderful women who are listening to me. One of the important messages I would like to give on this occasion of Women's Day is please take care of your health, self-care and awareness about cancer prevention. So, can cancers be prevented? Saying or stating cancers can be prevented is oversimplifying a complex problem like cancer. It is safe to say that cancers cannot be completely prevented. What we can do is reduce the risk factors which are responsible for few cancers. One such is cervical cancer, where we have a very good screening technique and we also have a vaccine for it. So, cervical cancer is an increasingly public health problem in India. It is the second most common cancer in women in India. So, and cervical cancer is caused by a virus. It's called human papilloma virus. Because of the colonization of this virus in the cervix, in due course, in few years, can lead to cervical cancer. So, what does the vaccine do? So, the strains which are responsible, the virus strains which are responsible for this cervical cancer is HPV 16 and 18. So, incorporating this by recombinant DNA technology, we have cervical cancer vaccines called Gardasil and Cervarix. So, Gardasil can be given under 15 years of age in 2-dose schedule, 0 and 6 months, and after 15 years of age as a 3-dose schedule, 0, 2 and 6 months. So, Gardasil is a quadrivalent vaccine and Cervarix is a bivalent vaccine. So, what does it do? Can it prevent cervical cancer? Yes, to a certain extent. It prevents cervical cancer in up to 70% of patients. So, what is the ideal age to give this cervical vaccine to your young girls and women? So, the ideal age would be 11 to 12 years. Although guidelines say it can be stretched between 9 to 45 years. What is the rationale in giving cervical cancer vaccine in such young girls is it is effective if given before the sexual intercourse starts. So, in young girls 11 to 12 years, before the colonization of human papilloma virus, if vaccines are given, it is found to be effective. So, when can this be given? As I told, at 11 to 12 years. If a lady is above 15 years, you can still give the vaccine, although the efficacy comes down in a 3-dose schedule, 0, 2 and 6 months. So, can it be given in boys? Yes. So, it can prevent certain cancers like anal cancer, certain genital warts and head and neck cancers also. But dose schedule and administration in boys, the guidelines are still evolving. So, to sum up, cervical cancer vaccine is an effective method to prevent cervical cancer in women. Apart from this, lifestyle modifications like good exercise schedule, at least 20 to 30 minutes exercise at least 4 days a week, and reducing a sedentary lifestyle, diet rich in nutrients, fruits, vegetables, less of red meat, less of processed and packed food, and a positive attitude can reduce and improve outcomes in most of our cancer patients and in general population. Thank you and take care.